And with that, I think this then leads us into some of the other central ingredients of the treatment itself, as we're going to be focusing on in our individual work. And that is, now what I got to do is get a better understanding of what's leading Sophia to engage in these suicidal behaviors in the first place. And one of the most effective strategies for doing that is what we call a chain analysis. And so a chain analysis is a detailed assessment of a particular situation or an instance of behavior that we're going to look at in pretty close detail. And the reason we're doing this is we're wanting to get a better understanding of what's leading to this suicidal behavior in the first place, so we can work on figuring out other more effective ways of helping the client deal with the problem. Now, a chain analysis is typically done on specific instances of behavior. And so with Sophia, what I decided early on in treatment is I wanted to get a better understanding of why it is that she took all of these pills after her partner said that he no longer wanted to be in a romantic relationship. And so I began by asking her just that. So, Sophia, you were saying that, 2 weeks ago on Tuesday, you took all of these pills. And I'm wondering what was going on just before you did that. First of all, were there vulnerability factors? And what I mean by that, was there anything going on that might have been setting you up for being more likely to do it at that time that went beyond the immediate instance? I don't know, if you weren't feeling well, for instance, that can set you up for being more vulnerable. If you were hungover, if you were sleep deprived, if you were malnourished, all of these types of things might not relate specifically to that moment, but set us up for being more vulnerable at that moment. We'll spend time considering just that. The other thing we're going to be looking out for is then the more immediate links leading up to the problem behavior. This is why we call it chain analysis. It's kind of like a chain link fence, in the sense that you're looking out for the links that lead to the problem behavior. We're also going to consider any consequences that occur after the behavior as well. And so what ended up happening is Sophia described, again, as her partner said, only wanted to be friends, experiencing a great deal of sadness. And it was soon, almost immediately when he said that her suicidal urges went up. She's thinking to herself, I'm never going to find a romantic partner. I'm going to be alone the rest of my life. She's thinking to herself, I'm never going to be able to develop other friendships. She's thinking life is going to be unbearable if that's the case. And so we can see how there's a variety of thoughts or cognitions that are also contributing to her distress. And this is one other place that I might decide to intervene. She's also experiencing a great deal of fear. She's hyperventilating. Her heart rate is increasing. She's sweating. She's feeling nauseous. And she's having a hard time knowing how to manage some of those feelings, including the body sensations, or maybe it's that emotion of fear that goes along with it. From there, what ended up happening is she ended up, first of all, leaving and going to her room. And it turns out that at the time, she had had a bottle of vodka in that room. And so what did she do? She started drinking. And then lo and behold, what did she do from there? She pulled out a bag of pills that she had been stockpiling and took them. So again, this is what happened during that suicide attempt previous to our work together. And if you think about it, part of the reason I'm doing a chain analysis is I got to get a better understanding of what was leading up to the problem in order to figure out how to intervene. What we know is actually, as she started drinking, she started feeling a little bit better in the moment. As she started thinking about suicide, she started feeling a little bit better. But of course, she then did this and thankfully lived, but she felt a lot of other emotions following it. There was a great deal of shame, anger towards herself, because it's some of these behaviors that were leading partners to leave her in the past. So these are the variables that we're going to be paying attention to when we do a chain analysis. And again, the primary reason we're going to be doing it is so that I can then have some better ideas, and we can come up with some better ideas for managing that situation. Number one, we can be approaching the cognitions. We can be looking out for other ways of thinking about this situation, or considering other ways of thinking about this situation. Number two, we could be teaching her some relaxation strategies for better managing this intense distress at moments when it arises. Again, there's a variety of different skills in DBT for doing just that. Another thing we might do in this situation is we're going to be trying to remove the means. The fact that she had a stockpile of medications, of course, makes it much easier for her to do this thing. And so as a therapist, I'm going to be looking out for what we can do to help get rid of those. And I'm going to be asking for a commitment and troubleshooting just that. The other thing that we could be doing is also targeting that substance use. Her using substances preceding the suicide attempt shows that's something else we're going to want to work on trying to remove. So this is, again, that chain analysis, and it's a central ingredient in DBT. It's getting a better understanding of why my client has made these previous suicide attempts so we can figure out alternative ways of helping them deal with those links.